Welcome. The Best Practice Briefs are a partnership initiative of the South Dakota Foundation for Medical Care and the Great Plains Quality Innovation Network. My name is Stacy Fredberg, and I have the pleasure of working for both SDFMC and the Great Plains Quinn in the community coalitions. Before we begin, there are a few items I want to review with you. Today's session is being recorded and it will be posted on the sdfmc.org on the Best Practice Briefs webpage. All lines will be muted throughout the presentation. Please add any comments or questions to the chat and they'll be addressed at the end of the presentation. Everyone knows bad habits are hard to break and addiction is even more difficult. New vaping products have caused a major setback in the fight against tobacco and nicotine, especially among South Dakota's youth. This Best Practice Brief series provides information on programs and innovative solutions for reducing the use of tobacco and vaping products and improving the quality of life for South Dakotans. Today, Jordan Munga is going to share how their team is working to kickstart the quit at Avera Addiction Care Center. Admitting the need for help is the first step toward recovery. And the Avera Addiction Care Center in Aberdeen focuses on treatment for the whole person to encourage and promote healing and recovery. Use of tobacco and vaping products often go hand in hand with alcohol, drugs, and gambling. Coordinating the delivery of a Kickstart kit at the time of admission eases the transition to a tobacco-free environment and extends the healthcare team for addiction support. Thanks for sharing with us today, Jordan, and I'll go ahead and stop and you can begin your presentation.
Okay. Good afternoon, everyone, and thank you so much for joining me today as I speak to you about our pilot program that we have implemented here at Avera Addiction Care Center in Aberdeen. Again, my name is Jordan Munga, and I'm a grant coordinator with AACC here in Aberdeen. I want to say thank you to Stacy and the Great Plains Quality Innovation Network and the South Dakota Foundation for medical care for allowing me to be with you today. Our pilot program is one of only a couple in the state, another being at one of the correctional facilities. And our ability to be able to implement our pilot program was one that we were very excited to be able to implement here at Addiction Care. So I'm happy to be able to share with you today what we have learned and what we know and where we're headed with it in the future. So our tobacco cessation timeline here at Avera Addiction Care Center, we used to have a different facility being on South Main Street in Aberdeen for many years. And we found that our location wasn't ideal in being able to be the best for our patients. And so the services that we provide at Avera Addiction Care Center here in Aberdeen are anything from outpatient services that way into treatment, which is the evaluation process. We have a school-based and community-based prevention program, and we also offer our levels 2.5, 3.7, and intensive meth treatment programs. So our patients that were in 2537 and an IMT were often getting bused over to our other location. We were able to move on campus at Avera St. Luke's in 2021, February of 2021. And this allowed us the ability to be able to have ease of services for our patients. At that time, when we moved campuses, Avera St. Luke's had been for many years, had been a tobacco-free campus. And the only part that was allowed to break that policy was addiction care. And so we took several months to be able to really look at, are we serving our patients the best that we possibly can by still allowing this? There were still many violations of the tobacco policy, the in and out use of the ID cards to be able to come in and out of the building, extending those breaks. We were just seeing a lot of continued issues. And then finally came to the place of deciding that, you know what, we're going to go tobacco free as well. And if we're going to really be looking at developing the whole person and the whole wellness, let's make sure that we're starting them off on that journey to wellness by giving them the ability to be able to kickstart their tobacco cessation as well. So we had then applied with a lot of the community-based efforts that we were doing and some of the data, the prevalence data throughout our county that we had seen with our tobacco use, and found it to be pertinent for us to apply for a community school partnership grant that was from the state and working with Black Hills Special Services. So in receiving the community school partnership grant, a major portion of what we wanted to address was cessation within Brown County. And one of those things that we really wanted to do is being able to start at home here at Addiction Care. So our policy did go into place in August of 2021. And for FY22, we did receive those dollars through the community school partnership grant. Through those dollars, what we had chosen to do was a pretty big blitz of a media campaign that went out in print ads through the Aberdeen magazine, etc., the Aberdeen American News, and through all of our local radio stations, utilizing the Be Free SD materials that they already had that were available to us and are free for everybody to be able to use. And then we started putting together quit kits. We put together 800 quit kits that went to 15 different locations throughout Brown County, many of them being businesses, healthcare facilities, and different schools as well, that we're going to disseminate those in an effort to really promote the South Dakota Quit Line and to be able to start the conversation about cessation. So in that process, we were contacted by the South Dakota Quit Line to be able to see if our facility was interested in a pilot program, in being able to have our patients have direct access to the 2-week Kick Start kit that would be available through the website. And so we found that this was going to be a great partnership for us to be able to enter into for our patients and for our community as well. So successes that we have seen thus far in entering into the pilot program with the South Dakota Quit Line is that we've had a major reduction in our tobacco policy violations here at Addiction Care. Prior to admission of any of our programs, people know that Avera St. Luke's campus and our treatment facility are tobacco free, that they are not to bring any vapes, cigarettes, whatever tobacco product is their preference with them. If we are able to speak to them over the phone prior to their admission, we will get verbal consent and walk through with them the process of being able to order the quit kit through the South Dakota Quit Line so that it is here prior to their admission. If we're not able to talk to them prior to, maybe because they are incarcerated or we're just not able to get a hold of them, then we will work on getting the Quick Kit ordered immediately upon their intake at admission. What we are noticing is that if we order those Quick Kits sometimes prior to noon, because we are peer to Aberdeen, sometimes the USPS angels get them to us actually overnight, which is fantastic. If not, it can get it to us within the next business day. So sometimes it's only about a day and a half after admission. So sometimes there are people that have additional patches or gums that are willing to donate to get them through in that process. To date, since we have started in February of this year with our pilot program, we have enrolled 43 of our patients for the 2-week Quick Start kits. We are starting to also track those that follow up and choose to get the additional 2 weeks, and we are starting to implement additional evaluation with the South Dakota Quit line that's going to give us even more of an idea of successes that are happening. That evaluation process is going to include our own internal PI study that is going to give us the evaluation of how it went for them, if they would recommend it to a friend. The South Dakota Quit line is also going to be doing follow-up calls. And when we do our 30 and 60-day follow-up calls, we are going to ask whether they are continuing to stay quit as well. And those are going to begin this month. We were able to do the promotion of the South Dakota Quit line throughout Brown County through the dollars that we received through the Community and School Partnership Grant, and some of those being in-kind services also have continued as we have partnerships with the Aberdeen Magazine, and then other the Chamber of Commerce as well, being able to promote those on their social media, their websites, and through their dissemination of their print materials as well. So those 800 Quick Kits, we only kept 25 of them here at Addiction Care, as we had utilized those with our outpatient treatment patients that may have been interested in receiving Quick Kits. But now that all of our counselors are well versed and trained in the process of being able to enroll those patients, we have disseminated those and they're no longer needed. So we're able to actually work on getting those quit dates set for our patients that are in outpatient, and making sure that we have a really streamlined process of getting our patients enrolled so that they don't have to go very long without having one of those nicotine replacement therapies, the NRT products that is available to them. So what does the patient enrollment actually look like with the South Dakota Quit line? I'm going to take you now to the this is what the form, and if you can't see this, please put in the chat that you can't.
It's showing up. It's showing up fine, Jordan. Looks good.
Perfect. Thank you so much, Stacey. So to request a Kick Start kit, what any of us here at Addiction Care will do is working with the patient to, the shipping address comes here to Avera St. Luke's, but we will enter in the patient's email and their phone number so that they can actually be contacted after they leave our facility. The Quit line does know that as it's getting close to the end of the 2 week, that they do actually have to call us here at Addiction Care to be able to reach those patients. So we fill all of these out, and then we go through a series of questions with the patients. Just as how often in the last 30 days have you used a tobacco product? What is your preference in the tobacco product that you use? How long after waking up in the morning, do you use a tobacco product? Are you planning to quit, or were you planning to quit? How did you hear about it? Then the options that the patients have to be able to enroll in are the gum, the nicotine patches, which are available in 7, 14, and 21 milligrams, and then the lozenges as well. We really prefer that our patients are actually enrolling and getting the patches because they are easy to disseminate for them, and that they're not having to carry around a lot of the gum, and that they're also not sharing those things with each other. So just to make sure that we are following protocols in our medication management, and with the approval of our medical director, Dr. Shauna Schmidt, we do really try to push our patients towards the patches. And those that have gotten the gum, we have not yet had anybody enrolled to get the lozenges, but those that have gotten the gum have said that it is not as effective for them as the patches. So those that have actually enrolled and gotten the gum, after the 2-week period, they have actually decided that they would rather switch to be able to get the patches. So that is that is what they have available to us. And then upon leaving, even if they enroll and they get 2 of the sets of the 2-week Kick Start kits with the South Dakota Quit Line, upon leaving, they are still able to access the Quit Line for the 12 weeks of the Quit Line coaching as well. So we make sure that we set our patients up that if they've quit for the 28 to 30 days that they're here with us, if they're in 2-5 or 3-7, or the 16 weeks that they're here with us for our IMT program, we want to make sure that they are still set up with the proper cessation tools, education, coaching, and NRTs if they so choose. We like to be able to make sure that our patients are very well aware of what they are enrolling in. If it is myself or it is one of the counselors, we take plenty of time to be able to disseminate the Quit Line brochures to them, that they have the card, as well as our patients have access to the phones and can call the Quit Line if they're needing some coaching as well. So I want to leave this time now open for anybody to ask any questions about our process, and where we are headed in the future, about our evaluation. And I want to thank you for taking the time to learn more about our pilot program, as the South Dakota Quit Line is very interested in being able to open that up for more facilities to be able to have access to those for their patients as well. So I'll leave it open for questions now.
Thank you, Jordan. I know you talked a little bit about the data tracking that you've been doing. And so how do you coordinate with the Quit Line? Is there a way you coordinate to tell after a patient leaves if they continue to utilize the Quit Line services?
That's a great question. And that was an element that we had not thought of prior to. So in conversations with the Quit Line, what we have decided to do is, upon a patient's discharge, we have evaluations that they fill out about their treatment as well. So we are going to also be implementing a really simple 8-question survey about how they felt about utilizing the services in the pilot program. And then we're twofold. There's going to be follow-up with the Quit Line on their end, about continuing to utilize those services, and they're going to be taking all of those that come from our facility that they know that we filled out the quit kit, that we are going to be able to then quarterly be able to see those that decided to continue on that journey, receive additional NRTs or coaching, or those that have ceased a partnership or anything with the quit line. But then we'll also be able to, in our 30 and 60-day callbacks, and then a year, be able to find out, did they go back to using tobacco products, or did they quit?
Thanks, Jordan. Just a reminder, if you have questions for Jordan, you can enter it in the chat, or you can also unmute yourself and ask your question that way. I was going to ask too, Jordan, how are you do you document in the patient chart then their participation with a Kick Start kit, and how does that side of the process work?
Yes, so the counselor will, upon intake with the patient, they are going to make sure that they put in their notes that they chose to enroll in the program. Once the kit actually arrives to us, we do have a medication record that it is documented in, because as per our medication policies and safety, patients will have to sign those out every day to be able to get themselves a new patch and that will track. Those aren't things that they can just have with them, because we want to make sure that they are being utilized for the intended purpose and utilized safely. And then we will, we also then, is also documented then when they receive a follow-up call from the quit line, that they did have that quit coaching call, and whether they chose to receive an additional 2 weeks, or if they declined as well. We also internally, we have our own tracking system of the day that they enroll, who enrolled them, and then when when the quit kit actually arrived, when it was disseminated, and then if they got another 2-week one, etc. Which I'm happy to share that tracking form if anybody decides that they would like to enter into that for their facility. I'd be more than happy to, because I don't believe in don't reinvent the wheel. If it's
Right.
out there, share those things.
Yeah, that's we like that philosophy too. That's why we do these best practice briefs to begin with. So do you think, Jordan, that this process will be extended potentially into your other areas? I know this is specific for your addiction care center, but has there been talk about extending it into your hospital patients or your clinical care in a different way? And how does what you do with tobacco cessation compare to what's happening in the rest of your system?
Yeah, great question. I know that there has been talks about being able to have conversations surrounding that at other places as well. Those have yet to happen yet, but our counselors here at Addiction Care, if it is their time to be on call, if they receive a consult for chemical dependency of a patient that happens to be in the hospital, they will talk to them about tobacco cessation as well, if they are a tobacco user and if they are looking to be able to quit. We have also disseminated the quit line brochures and business cards to other facilities, other clinics, etc., etc., so that they do have those things that are available to them. But that is all part of, our rollout of making sure that everybody knows that they have access to it.
Thank you, Jordan. I'm not seeing other questions in the chat box. Just so everybody knows, I did put in the chat box Jordan's contact information. So if you want to follow up with her and get some of those resources or talk to her about her pilot project, you can contact her at her email there. Also, just a reminder to please take a moment to complete the evaluation, and that link is in the chat box as well. We are always looking for opportunities to share best practices and insights. So if you have an idea for a topic you'd like to hear, or you have a best practice that you'd like to share with everyone else, please feel free to let me know that as well, because we'd love to follow up with you there as well. So as we close, we just want to thank Jordan for her time and expertise in sharing with us, and just a reminder that there are resources out there to support tobacco cessation, nicotine addiction through the Department of Health. And so we'd be happy to help you hook up with those. If you have any additional questions, please reach out. And thank you again for joining us today, and enjoy your day. Thanks again, Jordan. Appreciate your time.
Thank you so much.